So one of the very common questions that I get is what causes obesity? Why do some people gain weight and others don't? This is a very complicated question with a very complicated answer, so we can get into that. There are 4 different things that we can discuss that can cause obesity, so no one thing is going to cause this. There's an interplay between the environment, the genetic makeup of a person, several biological factors in their body, and psychological factors as well. The environment that we have is very high calorie. We have a lot of fast foods that are easily available. They tend to be less expensive than healthier foods, and it's a lot more convenient to just drive through somewhere, I think, than to go in the grocery store and plan out a healthy meal. So we do have this fast food environment. Technology has also made us a lot less active. So we used to, get up and shop and walk around a store, and now you can get online and you can order things. A lot of jobs require you to sit at a desk, and so our environment is not very conducive of a very healthy lifestyle anymore. Genetics are also a very big part of obesity and the causes of obesity, and this is something that is under a lot of research now. We're discovering more and more genes that have to do with the onset of overweight and obesity. And about 70% of a tendency towards a particular body size or shape has to do with genetics. So the remaining 30% of that is due to these environmental factors that we just talked about. A risk of obesity is about 2 or 3 times higher for someone who has a history of obesity in their family. So we usually talk about first-degree relatives, parents, siblings, and children. And so if you have somebody in your family that is overweight or obese, then you have a higher risk of becoming that way if you're not already. There's an extreme obesity category where they have a BMI of greater than 45, and this puts people at a much higher risk of inheriting this. So if you have someone in this category in your family, then your risk for becoming extremely obese is 7 to 8 times higher than someone who doesn't have a family member in this category. There are over 140 genes that have been identified in the DNA sequence that can contribute to obesity. So as you can see, there's not any particular one thing that we can focus on. And this is probably just the tip of the iceberg also. There's likely hundreds and maybe even thousands of contributing genes. Moving into biological factors, this is other diseases and states in the body that can contribute to gaining weight. None of these is going to cause a person to have obesity without other things going along with it. But we do want to address it because we don't want to leave someone with something that can be causing them to gain weight when we're trying to help them lose that weight. So here's some of the examples. Hypothyroidism is certainly one of the first things that we'll check for. This is a simple lab test, and we can see, is this person's thyroid hormone low? Then that can contribute to some weight gain. These other things listed here are things that we can test for, and some of them are easily treated. One of the things that can contribute to weight gain is something that we as healthcare professionals do, and that's prescribing medications. So as we're treating something that may be a result of obesity, we want to make sure we're not giving you a medication that's going to cause you to gain extra weight. And so listed here are some of the medications that you might see typically prescribed in a primary care or specialty setting. And here are some antidepressants and mood stabilizers. These can be some of the worst as far as causing some extra weight gain. And a lot of times we have to weigh the risks and benefits, and we want someone to maintain a good control of their depression and other mental health issues, but we don't want to give them something that can cause them to gain a lot of weight. So we may want to talk to the patient, have them talk to their psychiatrist if they're seeing one, and see if we could probably switch from one to another that may cause either decreased weight or be a little bit more weight neutral. Some of the other medications are for blood pressure and for diabetes, and of course these complications can be caused from obesity. So we don't want to treat the diabetes or the heart disease with something that's going to make them gain more weight and make these conditions worse. So we want to tend towards the medications that can cause weight loss or even be more weight neutral. There are many hormones in the body that can actually cause you to gain weight. There are several signals that tell the brain to eat or tell the brain that you're full. And a lot of these can come into play when somebody's trying to lose weight or trying to maintain their weight loss. Leptin is one of them that has been studied for several years now. This is released from the fat tissue itself. So we used to think that the fat tissue was just something that was a buffer, it was something that keeps you warm in the winter, but we realize now that it's a very active organ and it does release several hormones. Leptin is one of those. Leptin works on a place in the brain called the hypothalamus, and the function of this is to make you feel full. It tells the brain that you are full, so you can stop eating your meal. And so as you can see from this graphic, the yellow globule there is to represent some fat tissue, and that leptin is released and goes to the brain, and it tells you that you're full. So what happens when you lose weight? Well, your fat tissue is going to decrease, and so you're going to have less of a leptin signal. And so then that I'm full signal gets smaller. And so as a result, a lot of people tend to gain a little bit more weight after they have lost it. In obesity, that fat is larger, there's greater size of fat cells, and so you do actually have a higher leptin level. And so then that I'm full signal is there. So that doesn't seem to make a lot of sense to people, because if you have more of a leptin level in the brain, why are you still feeling hungry? Why are you still gaining weight? And it has to do with a lot with the things that we're eating. High fat foods that we see in a lot of fast foods and junk food can actually cause some permanent changes to the brain and can block these signals. And so then that I'm full signal is blocked, and it's almost as if that leptin isn't even there. The next hormone that we're going to discuss is called ghrelin. Ghrelin is the only hormone that we really refer to as a hunger hormone. This one tells the brain to eat. It is released from the gut, usually before a meal, so that you can feel hungry, eat your meal, and then the level decreases. When you've lost weight, that ghrelin level tends to increase, and that's usually so that the body doesn't feel like it's starving. As you're losing weight, the body wants you to gain that weight back so that you can get back to your what we call a set point of a weight. So a lot of times when people have lost weight or they go on a diet, they feel like they're constantly hungry, and ghrelin is a lot of times the culprit for that. It does seem to make weight loss maintenance a lot more difficult. A lot of times we will see in people who don't sleep well or they're not getting adequate sleep that their ghrelin levels are also higher. Sleep has a lot to do with weight loss and weight management, so that's definitely something we want to correct. GLP-1 is another hormone. This one is released from the gut as a response to eating. So after you eat, this GLP is sent to the brain and it causes a signal to stop eating. It does other things, and we see GLP-1 medications that are similar to this hormone in treating diabetes, because it also increases insulin secretion from the pancreas, so it can help improve blood sugar control. I would say most people with overweight or obesity are going to struggle with their blood sugar a little bit. If they're not diabetic, then sometimes they're a little bit more what we call insulin resistant. So the GLP-1 hormone comes into play there. We do see decreased levels of GLP-1 in people who are obese and people with diabetes. This hormone acts as a fullness center to the brain. We see decreased food intake and also decreased appetite with this hormone. There is a weight loss medication that is a mimicker of this hormone, and it helps to make people feel more full and lose some weight. And finally, there are the psychological factors that come into play. This is a big one, and it's often overlooked. People have a reason why that they overeat a lot of times. Sometimes there's depression, sometimes there's a history of abuse, and then they get what we call emotional eating, and they eat to comfort themselves. So this is something that's important to address, whether that be through counseling or just through recognizing that and coming up with a plan with your physician to discuss it. There are eating disorders as well, and those definitely need to be addressed, and usually that is done with a psychiatrist or a psychologist. So as you can see, there's a lot more involved with losing weight than just eating right and exercising more. So once we address all of these issues, I think that you're going to see a lot more success in losing weight and maintaining that weight loss.